Welcome to The Pulse, where we delve deep into the issues and ideas that are shaping the future of education. I'm your host, Rick Surrency, Superintendent of the Putnam County School District, and each week we'll be talking to teachers, administrators, and other experts in the field about the latest trends, best practices, and most pressing concerns in education. Whether you're a teacher, a parent, or just someone who cares about education, this podcast is for you. So sit back, relax, and let's dive into the pulse. Hi, this is Rick Surrency. I'm the Superintendent of the Putnam County School District, and welcome to our podcast called The Pulse. And I'm very happy today to have some guests with us to talk about some benefits that employees that have our health plan can really, benefit from. And we're going to talk about our new wellness center. And as we begin the new school year, I think it's going to be really important for our employees to know what are some of those new benefits and how can they take advantage of them. So I have Mark, I have Andy, and I have Brittany here. And if you would just go around quickly, introduce yourselves and tell us what your role is, and then we'll get our conversation started. Mark, you want to start?
Mark Motl. I'm a chemistry teacher at Palatka High School, but relevant to this conversation, I'm the, I guess you'd call me the secretary of the insurance committee.
That is correct.
And also the president of the teachers union. So,
yeah, welcome, Mark.
Yeah.
And Andy Burnett, I'm the director of exceptional student education for the district, but I'm also the chairman of our insurance committee.
Yeah, welcome, Andy and Brittany.
My name is Brittany Bracewell. I'm going to be the provider for the new Marathon Health Clinic that we'll be talking about today.
Good. Welcome, Brittany. It's good to have you, and thank you for coming down, okay? So let's start off, and we don't want to assume that our employees know anything about this, okay? And we want to give you some quick background and really a lot of information just so we can get started, because I'm just anticipating there will be a lot of questions generated from this podcast. So Andy is president of the District Insurance Committee. Give us a little background on how far we've come. How do we get to where we are now?
That's a good question. I'll just give you some background, too, of our insurance committee so everybody knows how we go about making the decisions. We have 4 members from the union and then 4 members from the administrative side. Mark and myself are on the committee, Thomas Bowling, Diana Drew, and Jonathan Odom, and then Michael Green and Paul Smith and Tammy Heath from the union. And so we meet approximately every month to make decisions about what we would like to see happen with our health services to our employees, and then recommend that to the board. This particular journey with thinking about a wellness center or a clinic probably started 5 years ago. It's one of the reasons that we went self-funded, so we could have the reserves built up to do something like this so we could offer it to our employees. We visited several different sites and considered about 4 ways to do this, but we really, really like the Marathon model. They're in St. John's, Flagler County School Districts as well, and probably there's approximately 15 other districts in the state. We really enjoyed how they do what they do, and we also enjoyed where we could look at our own data. So we get a data call every month. We can see what services have been used. We can see the feedback from our employees that they have given, and then we can make some decisions about what's best moving forward or what we should change that's going to be responsive to our employees' needs. So we really like that part of it.
I've been employed in the district since the mid-'80s, and I know in years past, not singling out anybody, but I know a lot of times our policyholders, they got sick or they had the flu, they would run to the ER or do something that would result in a large claim. And I think we have educated, our committee and our carrier have educated our employees. First of all, do your wellness visits. And second of all, follow certain procedures where it's not going to come back and really have an impact on the overall policy. And I think that's what
It's a good point. I mean, we look at all those numbers, and you are correct. In the past, people would go to the ER for things they didn't need to, and the ER is very expensive, and that money would affect our bottom line when we're looking at the services we can provide.
And Andy, just one thing, we make a lot of assumptions, but when we talk about the insurance fund, can you just briefly clarify what constitutes our insurance fund?
Oh, it is a separate fund that we put aside. The board makes contributions into it, and it sits separately from other expenditures. And we look at that to pay, not to get too deep in the weeds, but we're paying right now insurance premiums and some different other things that we have to provide our health plans right now. And we've got the reserve built up, and we've looked at the long-term expenditures going out, and we know now we're at the point where we can offer this. Because like I said, it's something we've thought about and we've been preparing for several years. And so now we're at that point. We've got that money set aside, so now we can do it.
Well, I just want to credit the insurance committee. And I remember when I first came in the office, the insurance committee had a representative from every school, and just to get that many people to agree on one thing. But now we've refined the committee, and y'all really have a system in place where you really have been strategic, and I can't be more proud. I'm proud of our employees for bringing down those claims, and we are now where we are because people have really worked together. So thanks to both of you.
It's a great committee. I mean, it really a lot of good discussion goes on in that committee, and it's I've enjoyed being the chair of the committee.
That's awesome, and you probably learn a lot more about insurance here.
I learned more than they didn't teach me this when I went to Ed Leadership. I'll tell you. So.
Well, Brittany, welcome, and I know Brittany is representing Marathon, and I know that our committee chose Marathon for a number of reasons to partner with, and I know they visited some sites like you mentioned, and I think people need to understand who Marathon is, and if you can just kind of give us kind of an overview of the company, and because they're gonna be working alongside us in this journey, and I know when they come to the wellness clinic, they will probably see you a lot of times. Is that correct?
All the time.
All the time,
Unless
okay.
there's a STEM provider.
So
Yep.
tell us a little bit about Marathon, if you would.
Well, I fell in love with Marathon working as a locum. So I would actually just travel to all of the different clinics throughout Florida that they offer. And I really did not want to go back to working full time, but I did say, like, if I did work full time, it would be for Marathon. So it's a really good company. They treat everybody well. Everyone that I've gotten feedback from on an employee standpoint has gone well. I love that they offer a lot of time to spend with the patients. It's not like a 15-minute time period where you're in the room, you're out of the room. You get to actually build relationships with your patients. And I think as far as preventative care, that makes a huge difference in the impact that you're going to have on your patients, including them in their decision making and having the time to follow up when it's necessary.
And if it's my understanding, Marathon actually runs it, or actually they go out and you solicit some of the medical personnel to work there. Is that my understanding? Or what's the relationship? Do you actually bring people who work in the clinic? Do you work that out to bring these people in?
So each clinic will have their own hired staff. And so we have two MAs. We've got Jennifer and Sherry, and myself will be the provider. We've been at the clinic all day setting up, so excuse my attire. But you guys will have your designated staff at the Putnam clinic. So it would be me, Jennifer, and Sherry.
Gotcha. And to me, it's really important that our audience, and I'm not sure who can give us the information, and we can actually put that address on the screen, but kind of gives a general idea where it's located.
It's actually right down the street from the hospital. I think that's the only hospital in Putnam.
Yep.
I could be wrong. So 700 Zeagler Drive, suite number 4 in Palatka.
And we can put that on the screen. And so if you know where the hospital is, it's like right across the street from
Right
the
across
hospital.
the street.
Across Zeagler. Well, welcome, and thanks for that explanation. And look forward to seeing you in the Wellness Center.
Look forward to seeing you.
So, Mark, talk to us a little bit about employees and the ones who have policy. Who's eligible to use this service?
Our Wellness Center is going to be open to all of our employees that are covered by our group health insurance. So any employee and their dependents who are covered by the health insurance. So if they're on our Blue Cross plan right now, then they can visit the clinic. And one of the important things to understand about this is that those folks who are eligible can visit this Wellness Center at no cost to that person, to the employee. So we've got a zero cost when they come in for acute care or preventative. There are some medications that will be available on site I don't have that list memorized, but we got some, and any of the medications that they get right there, also no cost to the employee. So they won't even have to go, some of these prescriptions, they won't even have to go get those filled somewhere else. They'll be able to do kind of one-stop shop.
So real quick, we're talking about low-level type health situations. I mean, if you have a broken arm or something, or that's probably going to be above what they would do, but maybe the flu or some type of,
Absolutely. I think Brittany could probably answer that better than I can, but orthopedic services, you'd have to probably go see, someone, but
it could definitely be the initial stop. And
yeah.
then we could order x-rays, see if there is a fracture,
Okay.
and refer out accordingly. But it will be acute and chronic visits. So like diabetes management, high blood pressure, high cholesterol, whatever the ailment.
So really, and that's a great point. If you're not sure, should I go to the wellness center? Should I go to the ER? You can always go to the wellness center, and then you could direct them or refer them. Absolutely. Is that correct?
Absolutely. Yeah.
So it's good to get into the habit of, at least making that an option first.
We will have a referral coordinator on the marathon team with Putnam County too. So say I do need to send a referral out to a specific provider, say it's an orthopedic, they'll help find someone in network with your insurance within your proximity and then set up the arrangement to get you on their schedule too.
That's great. That's great. Mark, anything else that our employees need to know as far as using
I think
the service?
we've designed the hours. One of the reasons, again, we went with Marathon and having our own clinic that we own and operate like that is that we can control the hours. So those will be up on screen. I understand for this podcast, but the hours are kind of vary a little bit depending on the day of the week, so that we can kind of handle folks that need to go in early in the morning, folks that need to go later in the afternoon, and that was a long conversation to figure out what works best, what will work best for our employees. We spent a long time on that, and the conversation too. Let me mention the $0. That was an important conversation for us as a committee, because we know that one of the barriers for some of our employees going to get that primary care is that out-of-pocket expense. On a high deductible health plan, they may not have the money in their HSA, so that out-of-pocket expense, we wanted this to be a no-barrier option for the employees on the health insurance plan. So that was a big important conversation we had in the committee, to make it a $0 cost for the members to go.
So speaking of that, what about sports physicals and that type of thing? I mean, could they do that? And because I know a lot of the students who might be in the plan with their parents, is that something they could do?
I think initially, any of the folks who are actually covered by our health plan, I think that would actually be certainly be included. Some of the things we have as a committee kind of down the road, we're looking at all kinds of things that we can offer through our clinic, through the wellness center, but for other employees, for just students who go to our schools, those are something we may be able to look at in the future. We got all kinds of ideas for down the road. We want to get it open and make sure that the folks on our insurance plan start using it first, and then and see what else we can do.
And I know there's probably 100 questions that I'm trying to think of that other people will. Things like vaccinations and just general shots and that kind of stuff would be something there. So I think that we have a contact number. Do we not? A contact phone number or
for Marathon?
Yeah.
I can get it.
Well, and we can provide that on the screen.
Okay.
Because I think people are going to ask questions, and they can either by email or by phone or something. I want the viewers to be able to respond. So would you suggest a phone number, an email? What would you?
So the portal, Marathon will have a portal where patients can register and actually self-schedule. So we're going to offer in-person telephone visits and virtual visits just based on needs. A lot of the times you'll have patients come in, get labs, and if it's a simple review of labs, you don't have to take the time out of your schedule to come back for that. We could do that over the phone.
But people that want to have, if they have questions right now watching this podcast, do you have a number that we can put on the screen?
I do. I will give you the number.
Okay.
I can pull my phone out.
And we can get it later. We can add it later. That's not a big. I just want to make sure that people can have questions answered.
And the marathon is continuing to push out stuff. I got something in the mail 2 days ago. I think it was about the portal, and I got an email earlier. So we're continually pushing out information.
Right. I think too. Are we going to be putting this on our website?
Absolutely.
Yeah.
So there will be multiple methods of communication to the employees who are eligible. We'll have they'll be getting some postcards in the mail. I believe Jamie told me from Marathon, emails, stuff in the mail. So there are multiple ways that all of the folks who are eligible will be getting that communication with information on here's how you sign up. So
Very good.
as Brittany mentioned, there's an app, the Marathon Health app. I've already kind of set up my account there, and I haven't quite yet, but I was going to go ahead and make my first appointment for that opening week so I could say I've got an appointment. Yeah, but you make an appointment through the app, and like questions and a lot of the communication goes through the app.
I think he wants to be the first patient or something like there's a
that
door
time
prize
slot's
or
already
something.
taken.
Yeah, sorry, I was going to say it's already taken, and I'll be in the classroom for that first.
Okay. So tell us the grand opening. Let's talk about that real quick. When do we plan on opening?
It is, well, the grand opening is August 14th, but we are opening up on the 6th.
August 6th
Yep,
will be the
August
first
6th
day of
is
appointments.
Wednesday.
First day you can have appointments, and then on the 14th we'll have a little bit
Ribbon cutting,
bigger
kind of ceremony. Yeah.
So maybe in the time and all, maybe we can put that on the screen as well, and in case somebody wants to come to that.
Absolutely.
So that'd be great. That'd be a great day. And
Well, I tell you, the committee has just put in a lot of work. I'm so proud of everybody
Yeah.
on the committee. Happy about what this is going to do
Yeah.
for
Yeah,
employees.
we're so excited because this has been, as we mentioned, it's a multi-year process. 2 years since we really started exploring clinic options. About a year since we committed to Marathon, and then we're finally here with the clinic about to open, the Wellness Center about to open. It's very exciting.
it's kind of neat because I spoke to 30 of our new hires, our new teachers today, and I told them about Marathon and all that. What a great opportunity to recruit teachers and recruit employees.
Yeah.
I mean, to say we have this service, not every district in this area can say that. So I salute you guys, and thanks to Marathon. I think it's a great day for Putnam County School District. So I know we're going to have a lot of questions. Please call the number that we provide on there about anything, and we'll keep track of those questions. And if we need to have another podcast,
I would want to say this to the employees who do go. It's very important to the committee to make sure you give feedback, because we will look at that, and that's how we'll make decisions to change things. It could even be changing the hours.
Yeah.
We did bat around Saturday hours for a little bit. I know that would be convenient to a lot of people, but that's some of the things that we'll look at once we get them.
well, that's a good thing about it only being for the Putnam County School District. We can tailor it for our employees.
Absolutely. So-
And nothing against anybody else, but this is the advantage of having our own
Just
thing.
all the employees out there that go, make sure you do the feedback, as we do look at it.
Yep. Hey, and we want you to be well. We want you to be where you can work every day and all that. So we're trying to cut down on that. That's going to be a cost savings too. So
Absolutely.
all this is going to benefit our employees and our entire district. So I just want to thank all three of you for being here. I know we're kind of coming right out of the starting gate on this, but I think we provided a little bit of information that's going to be helpful. But please be sure to call or look at our website. I think we'll have some stuff up pretty soon, and then look forward to seeing you at the Wellness Center as soon as possible. So thank you all, and see you at our next podcast.
See you in the clinic.